Hey guys, this is Dr. Hub. Today we'll look at the Esi Act. As the Esi Act is of 1948. So to expand ESI, it is the Employee State Insurance Act as of 1948. So it is revised in 2019. So what is the scope? The scope is applicable to all factories in India. So what does the scope include? They include defense, there is railway, as well as the mines. So what about the finance contribution? It covers all employees getting income up to, so it covers the employees which get income, and this is up to rupees 2100 per month. Then looking at employee is 0.75, and this is of the daily wage. Employer, this is going to be the 3.25% of the employee's wage. Next, we'll be talking about the medical benefit. The medical benefit, it is nothing but 1/8 by the state government and 7/8 by ESI Corporation. So let's look at some benefits. So as per the benefits, the medical benefit, the full medical care is provided free of cost. So it's free in terms of sickness, in terms of employee injury, as well as in terms of maternity. Then what about the sickness benefit? According to the sickness benefit, it is given at 70% of the average daily wages. So it is given at 70%. This is the average daily wages, and for the duration of 91 days in 1 year. In order to qualify for the sickness benefit, the worker is required to contribute for 78 days in a period of 6 months. So you have to contribute 78 days in 6 months. So there is extended sickness benefit. So as per the extended sickness benefit, this is at full wages for sterilization procedure. Is that full wages, and this is for the sterilization procedure, and this is for a duration of 7 days post vasectomy. 7 days post vasectomy, as well as 14 days, and this will be post the tubectomy. So the total amount payable is double the standard sickness benefit. So total amount payable will be the double the standard sickness benefit. So it is double standard sickness benefit. And that is the rate is equal to full wages. It's equal to the full wages. Then comes the maternity benefit. So as per the maternity benefit, the benefit is payable at full wages for 26 weeks. So we have full wages for 26 weeks, and that is nothing but 6.5 months. This is for the pregnancy, and also 6 weeks for miscarriage. So 6 weeks, and this is following a miscarriage. Following a miscarriage, and 30 days for sickness arising, and 30 days. This is for the sickness, and this is arising out of the pregnancy. It also covers the premature birth of a child born to an insured woman. It also covers the premature child. Covers the premature child, and this is born to an insured woman. Insured woman. Next, we look at the dependence benefit. So, in case of death as a result of the employee injury, so in case of death, and this is as a result of the employment injury. So this is due to the employment injury. So the dependents of an insured person are eligible. So the dependents of an insured person, the dependents of an insured person, dependents of an insured person, they are eligible for the periodical payments. So they become eligible for the periodical payments. So the pension at a rate of 90% of the wages is payable. So 90% of the rate of the pension is payable, and it is shared by the departments in a fixed ratio. Shared by department in the fixed ratio on monthly basis in accordance with the prescribed share. An eligible son or daughter is entitled to the dependence benefit up to the age of, so the son or daughter, they are entitled to the dependence benefit up to the age of 18 years. Up to 18 years. And the benefit is withdrawn if the doctor marries earlier. So if daughter marries earlier, the benefit is removed. The benefit is removed. Then we look at the disability, the disablement benefits. The disablement benefits. So there is a temporary disability. So as per the temporary disability, at 90% of the wages as long as a person is disabled. 90% wages. Then the permanent disability. So permanent disability is a lifetime pension. There's a lifetime pension, and it covers the occupational disease also. Covers occupational diseases as well. Next, we are looking at the funeral benefit. The funeral benefit. So this is a max of, that is not more than 1500 rupees, 15,000. Then comes the rehabilitation benefit. So this is on payment of rupees 10. This is on payment of rupees 10. The payment of rupees 10, and here the insured person, and also his or her family, they continue to get medical treatment. So they get the medical treatment, and this is after the permanent disablement or retirement. This is after permanent disablement or the retirement. The next is to the employers. So what about to the employers? To the employers, there is an exemption from the Workman Compensation Act. There is an exemption. This is from the Workman Compensation Act. Then there is also the exemption from the Maternal Benefit Act. Then there is the income tax rebate. This IT rebate, and this is on the amount contributed towards the scheme. Amount is contributed to the scheme. Then there is also the exemption from a payment of medical allowances, from payment of medical allowances, and this is to the employees and their dependents. This is to the employees and their dependents, and or arranging for their medical care, or arranging for the medical care. Next, it also has the healthy workforce.